saw that, that's a mobile court that we saw with the trucks going, where they actually bring a court to a village and try to try a case. It could be from tens of miles or hundreds of kilometers even away, where people have to come, and sometimes the victims are coming and staying for many days in this village. It's challenging, but it's what I want to give you as a message is a little bit of hope that slowly but surely, what Shushu says is right. There's basically a climate of impunity. Horrible things are happening, especially these rapes of babies and children, and we're working on those cases right now to try to get that prosecutor, Mr. $100, to be removed from his case, so that a proper prosecutor who won't be bought off can try the cases. But there is, little by little, change, and more girls and women are coming forward, and that's progress that we've seen even in the 4 years since we started.
Just what the worst remembers or souvenir. Yes, it was the first testimony of the young girl in the beginning of the film. I feel we have to take this girl to go to Panzi hospitals, because there was 6 months that there was this problem, the pain in the cough. But the doctor and the local doctor refused that I take this woman to refer to the hospital. And in the bus, returning to because the car was broken, the car was tipped. To return to Bukavu, it's one day to the piste of the road, so the road. I said that we have to take this woman. It's incredible that the local doctor, don't make nothing, and they don't want that we go with this girl to the big hospital.
So let me turn it to you. If you have a question, please identify yourself, and please keep it to questions and not statements. Does anybody have a question they want to ask?
What's the extent of local infrastructure to share with the
diffusé un film, quelle est l'infrastructure locale?
Il reste du groupe, vidéo, une Bukavu, il reste toute l'infrastructure.
Pour la diffusion de ce film.
It's possible. Il faut un projecteur.
Just need
yeah, it may be screening in public places like football grounds, in high schools.
Yeah. And also this film was shown this week on television in DRC, partly because of the pressure of it being shown here at the same time. And the Congolese government on Monday lifted the ban on the film. They weren't thrilled about the film, as you can imagine. They lifted the ban on Monday 2 hours before it was premiered in Washington. And then the next day they announced they were going to show it on Congolese television. So a lot of people have TV, even in tiny villages. You'll see satellite dishes in Congo.
But you have to know that with my last film, it's the Sharia affair, the state crime. He is prohibited in Congo and was arrested in the country.
This is another award-winning film that you
yes,
made.
but when I go to Bukavu and the people ask me, go up to DVD, no, it's prohibited, no problem. At the shop, just next, you can buy its pirate DVD. Pirate. So it's not a problem. It's like the broad in the mirror. It's like the broad in the mirror.
Sorry, Eric, did you have a question? Yeah. Go ahead.
I was wondering if you could talk about, because this practice of sexual assault is such a systematic thing, if there have been any initiatives to talk to the communities about sexual health and how to approach
Yes, you see, at the beginning it was done by militias, rebels, military groups, and all the rebel group. But you know, because of the impunity it took another form. Now, civilians, young people, they started to copy because there was no justice. And for me, I think it was because of the trauma too. Because many young people saw how it was done in public. It was public rape. As you saw in the film, they asked two young boys to rape their mothers. So it was something which was public. And there was nothing done, but only the victims were rejected. But it pushed the community to leave because it was a shame to stay in the same place. And yes, there was a big work of sensitization which was done by many NGOs, female NGOs, fancy hospitals, international NGOs, to sensitize community, to accept victims, to show the problem of fighting against rape and sexual violences. Yes, it was done. There was a big problem what was done, and to show all the other forms of sexual violence, because it's not only rape, it all the kind of the forms of violence. I don't know how to say them, but there are people who are thinking that to beat a woman it's not a problem. So it was it was time to take all such forms and to sensitize about that. But the big problem still the lack of peace, mainly in rural areas. Yes, in Bukavu we can say, yeah, we live in peace, it's a kind of peace, but in rural areas where we had to work, where there are the big part of the population, it's a place that there is insecurity. It's a place that there still have the rebels group from Rwanda, the FDLR, the LRA, FNL, the ADF NALU. There are many foreign groups which are in the eastern part of Congo. So it's a cycle of violence. Even last time, every 4 years there is new rebel movement which is created, and there is a broken war in the eastern part of Congo. Okay. I'm very impressed with like a class that the doctor had with the young teenagers trying to prepare them, and for him, I guess he can't commit himself to do many things at the same time. So I'm wondering if there are other similar support groups for women like this, and what is the kind of support they get from the government, because it could be that the rapist from the government itself.
You want to answer that?
Yes, I'm going to, yes. The support that I got from the government, I don't know if there is really a support that people get from the government. I can't say that I know it, but I know only there are many lobby which is done to push the government to vote the laws, and yeah, it was really the first victory. It was the first law which repressed the rape and sexual violences. Congolese government has a beautiful law, but which is not enforced. Yeah, unfortunately, it's not enforced. Yeah, enforced. Yeah.
Just want to add though, in terms of, are there other people besides Dr. McQuaggy? That scene that you saw is in a place called the City of Joy that was actually started by the writer and dramatist Eve Ensler. Probably know her because she hangs around this part of town, who wrote the Vagina Monologues. And she started the City of Joy, and it's a center right next to Pansy Hospital that does leadership training for survivors of sexual violence. So all those girls that you saw in that class are among many now who in the last few years have gone through this 6-month program where they live there. And it's a small group that gets this training, but then they go back to their villages, that's the theory at least, to try and help support other girls and women. So it's sort of a, a knock-on effect, if you will. And then there are many other centers for psychosocial recovery, but it is an area, as when you ask Dr. McQuaggy what is the biggest challenge for the health and recovery of these women and girls, it is the psychological recovery part, because it's the most enduring, and it's there aren't many specialists in the DRC altogether, and it's going to take time to figure out what is the right methodology and format for this, and how do you spread that around. But there are more and more kind of efforts among psychologists in it. And there's also a center now at Pansy Hospital called the Dorcas House, which has all kinds of, they have music therapy. I just met a Swedish hip-hop music writer last night who has been in Bukavu and who's working in the music therapy program at Pansy Hospital, where they're teaching these survivors to write their own lyrics, and then they have a recording studio in the hospital center, and they're now playing the music on the radio in Congo. So it's